House Homeland Security Committee on Capitol Hill wanted to present a public discussion on this moment that we're in, the seriousness of it. We want to give information and dispel the misinformation that's out there. We want to talk about what's happening, what should be happening, and what's not happening. And this session, and I'm honored to be part of the session, has been convened by Mississippi Congressman, Chairman of the Committee on Homeland Security, Congressman Bennie Thompson. He is the committee chair for Homeland Security in the House. He has been chair from 2007 to 2011 and from 2009 to present day. Chairman Thompson, thank you so much for convening this very, very important conversation. And we also want to bring in someone that we also know very well. He is an American lawyer currently, public citizen like you and me. He served as general counsel for the Department of Defense from 2009 to 2012, and he was also the Secretary of Homeland Security from 2013 to 2017. I'm talking about none other than Jay Johnson. Secretary Johnson, thank you for joining us for a time such as this. I want to start off going to Chairman Thompson. Chairman, I asked former Secretary Johnson a question a couple of weeks ago doing a news story about this moment in time, something we have never seen before. And I asked Secretary Johnson, is this a national security crisis? And he said, yes. What is your comment to that? What do you feel, and are you in agreement with it?
Well, there's no question it is a national security crisis for a number of reasons. First of all of us are at risk. Our military systems are at risk. Our civil systems are at risk. Our democracy is at risk. And so it's to our own advantage for us to get beyond this. But in order to get beyond it, to be quite frank, people, we have to understand and go forward in a manner that's consistent with how pandemics are addressed. So we are absolutely in a crisis.
Secretary Johnson, we are seeing doctors, first responders, people on the front lines, I mean, people in the military, people in policing units, doctors are falling down from this, not just average American citizens like you and me, but people who are to respond to these emergencies. Is that one of the reasons why you're calling it a national security crisis as well?
When we think of 9/11, we think of our military heroes, and we think of our first responders at the World Trade Center and at the Pentagon. I believe when we look back on this crisis, when we think about the heroes who responded to this crisis, we're going to think about our healthcare community, our doctors, our nurses, our technicians who have put themselves in personal peril to support all Americans. So they are the frontline warfighters in this crisis. The reason I believe it's a national security crisis is, first of all, you have, at last count, 43,000 Americans dead as a result of this. And we're under stress in almost every respect in American life. Our economy is under deep, deep stress. And the government right now is focused on addressing this particular crisis, and I fear to the exclusion of others. You know, for example, FEMA is on the front lines. FEMA is part of the Department of Homeland Security, which I had the privilege to lead. And if we have a severe weather system or a tornado or a hurricane at some part of the country, FEMA is going to be extremely stressed in its ability to respond to that right now, given everything else it has on its plate at the moment.
So for both of you, and Chairman Thompson, I want you to respond first. So listening to what Secretary Johnson just said, does this mean that if something were to affect our nation, be it one of those crises that FEMA could be called for, they would be stretched thin? And if someone does decide to possibly do something against us because of a moment of weakness, are we able to stand up because of this moment we're in?
Well, I think FEMA would respond. The question would be, are we adequately supported for that response? Last week, here in Mississippi, Alabama, Louisiana, we had several tornadoes. So in the midst of a 50-state disaster declaration, here we had additional disasters occurring on top of that. So FEMA can only do so much because staffing, they only have so many people. So we are pressed more now than we've ever been before. The challenge also is whether or not the planning for the pandemic was what it should have been. To be honest with you, and Secretary can talk a little bit about it, it's not unique. The question is, were we resourced from a planning standpoint to address it? And so that's why every press conference you see is kind of a build up to what we're doing. Somewhere there should have been a plan on the shelf to address it so we could execute it. So part of the challenge we are managing right now, April, is how do we put the pieces together when the plan is not being carried out like it should be. So that's our challenge. And if we are on top of that, stressed with other disasters, it just complicates that situation more.
Secretary Johnson?
Well, first, I have to say this. I've known Chairman Thompson now since I became Secretary of Homeland Security, and he was ranking Democrat on the House Homeland Security and then became chairman. And I've learned to admire him. He's one of the wisest, most astute people I know in Washington, even when he's not in Washington, working remote from his home in Mississippi. But I believe, you know, in the Department of Defense, we used to say that the department, the US military, needs to be in a position to fight two major wars at once. And we'd like to think that the Department of Homeland Security could confront two major crises at once. This crisis is a once-in-a-century nationwide disaster, as opposed to a tornado or a hurricane or a flood, which affects a particular state or a particular region. This is an unprecedented nationwide disaster. It's unprecedented, but it's not unanticipated. Ever since the Ebola crisis in the fall of 2014, I can tell you from personal experience and observation that the possibility of a lethal pandemic has been uppermost on the minds of Homeland Security officials for the last 5.5, 6 years. In fact, when we in the Obama administration were leaving, we sat down with the incoming cabinet and doing a tabletop exercise that involved a lethal virus was at the top of the list of things we wanted to go over with the incoming administration. So there is, and there was at least, a plan on how to respond to this on the shelf. But indeed, this is a crisis that we have not seen in 100 years, of a scope and a magnitude that we have not seen in a very, very long time.
Former U.S. ambassador and former National Security Advisor Susan Rice said that she talked to her counterpart, the designate for her position, General Flynn. She talked to him about a potential for a pandemic. And she said that he did not really respond. And in turn, they dismantled departments and agencies that they had in place for pandemics, and those are no longer there. And the question also is there a crisis management team in this White House? And we have not heard of that as such. Mr. Secretary, I'm going back to you. Given your experience, and even your experience with dealing with the Ebola situation during your time in the Obama administration, is this administration prepared? Did they handle this adequately? This moment that we're in with the coronavirus pandemic?
Well, look, I've been out of office now for about 39 months. So I'm realistic to know that anytime there is a crisis, there's going to be ample criticism of whoever is in power at the moment. Somebody will always say that the government didn't act fast enough. Somebody will always want to second guess the actions taken of those in the chair. So I'm sensitive to that. Having said that, in this National Security Council staff, in this administration, in this cabinet, there's been so much churn and so much turnover, and you have so many people acting in acting positions, not Senate confirmed presidential appointees, that the president is not in a position to get the best advice, to be told things that he needs to hear that he doesn't necessarily want to hear. And that, I think, is a major source of my concern for the current administration's ability to respond to this very dangerous situation.
Mm.
Well,
Mr.
April,
Chairman,
if I
yeah.
can,
I wanted to ask you to respond to that, but also you were there. You worked with the executive branch during 9/11 and Katrina, and now we're in COVID-19, the coronavirus. How can you compare and contrast the two? And if you could please respond to.
well, and part of it, Jay talked about, it's about leadership, having the right people in place, and getting the politicians out the way and let the professionals do their job. Now, the professionals could be FEMA, it could be the Corps of Engineers, it could be some aspect of the Department of Defense. But let the professionals do it. And so what we have here is a, a cadre of acting people, as Jay talked about. We have the president's son-in-law heading up a division that no one knows what they do. And so those people who are in line don't have the confidence of the system, that they know what they're doing. And so from an oversight perspective, we try to ask a lot of questions. But when the inspector general and other people get replaced in the midst of what's going on, it's difficult. So what we have now, different from even Katrina or the Ebola, this notion that all hands on deck, this notion that those hands on deck know what they're doing. Now it's every day press conference, you hear something that you didn't hear the day before, or you hear something that conflicts with what you heard the day before. And that mixed message doesn't give the confidence in this administration that they really know what they're doing, or that we are in it safer because we declared this disaster. And so I have real challenges trying to get questions as chair of a committee. I didn't have that problem even when I was a ranker on the committee. So access to information is filtered through the White House before it's given to members of Congress. So that legislative versus executive conflict is more pronounced during this pandemic.
So, two things I just got from that. The White House is not speaking with one voice, in your opinion, from the unique perch that you sit. Not only are they not speaking with one voice, the experts are saying one thing and the president is saying another. But then I'm hearing you say that the things that are happening at the White House, you as the chair of the Homeland Security Committee are not getting the needed information. Do you believe, if that's the case, that it is about the fact that there is no head of Homeland Security right now, and that may be why your counterpart agency is not giving you the information, or what? What do you think that is?
Well, this is the fifth head we've had in 3 years. The person that is acting, number two is acting. The other 8 other senior positions in the department. They're all acting. So on any given day, that individual could be told, go home, and it's over. Well, that kind of permeates the entire organization. So from a leadership influence standpoint, people in the field know individuals are acting. The other thing that I'm concerned about is the notion that I have to somehow please the chief executive in what I do rather than do what I've been professionally trained to do. It always gets in the way. And so I've talked to governors, I've talked to mayors, I've talked to hospital administrators, emergency managers. We've never had a shortage of resources in any of the other challenges that I've been involved in to the extent that we have now. And now we have FEMA outbidding states who are outbidding hospitals. The system should be coordinated. And in this disaster, FEMA has the primary role for making sure that it works. One of the ways for getting FEMA in was executing on the Stafford Act. Well, we did that, but somehow FEMA's role has been marginalized in this process. And so I think we'll continue to see the problem. For instance, people talk about testing. Very simple thing. We've done about 4 million tests. And why brag on it when that's about 1.5% of the population in this country? And all of the medical people are saying we should be doing testing. So sometimes it's the, as you say, what the politicians are saying versus what the professionals are saying that's in conflict.
Mr. Secretary, you were once the head of the Department of Homeland Security. What are the responsibilities in that department at a time such as this, especially now since Congress is not hearing from this department and the President of the United States about what's happening, the next moves, etc.?
The Department of Homeland Security should have a central role in responding to a crisis like this. The way Congress constructed that cabinet level agency, it's protection of the homeland from land, sea, and air, but it also includes FEMA. And so within one cabinet level department, you have disaster response, you have the ability to regulate the borders, you have aviation security, you have the Coast Guard. And so, and with the existing authorities that Congress has given the executive branch, the Secretary of Homeland Security in a time of crisis like this has various emergency authorities to draw resources from other cabinet departments. FEMA, I believe, is not being fully utilized to the fullest extent of the law. It's probably too late for this now, but what should have happened was that FEMA should have been put in charge of marshaling and husbanding all the resources when it comes to PPE, ventilators, test kits, to make sure that what Chairman Thompson referred to, the bidding war between the states and the federal government, doesn't happen. What FEMA ought to be doing right now, under the oversight of the Secretary and the President, is to deploy those resources to various states and communities where they are most needed, not who the highest bidder is. And so I'm hoping that now that we're in a stage where we can begin to think about reopening our economy, we've got a ways to go there, and I'll come back to that, but that FEMA can allocate test kits and can marshal and get control of the inventory of test kits out there so that they go to the communities where they are most needed.
So at a time such as this, I'm gonna bring in a couple of states, and you're talking about FEMA. I talked to Michigan Governor Gretchen Whitmer within about a week and a half. She said the most pressing 3 issues or 3 items that they need testing kits, number 1, 2, masks, and 3, ventilators. And now we heard yesterday or within the last couple of days, the governor in the state of Maryland had to use his wife to help him negotiate to get 500,000 testing kits. Where's FEMA in all of this?
Well, April, what you just described is patchwork. If the governor of Maryland has to depend upon his wife to get his state the needed test kits, that's patchwork. And we should be doing better than that. And that's why I come back to this. That's why in a situation like this, a nationwide disaster, where the same resources are needed across all 50 states, FEMA and the Department of Homeland Security should be put in a position to allocate those resources. I believe that the legal authority for doing so exists through the Defense Production Act and otherwise, but if it doesn't, then I'm hoping that Chairman Thompson and others in Congress will take a serious look at whether or not the department has ample legal authority to prevent this kind of patchwork from happening again.
Well,
Chairman Thompson, yes, this is a direct challenge to you right now.
well, and I'm glad. One of the things I've done is recommended very quickly that we create something like we did in the event of when we had 9/11, to do a 9/11 style commission to look at the coronavirus pandemic and see what went right, what went wrong, to see if in fact this ever happened again, would there be a plan in place, and all of that to make it forward thinking too. Congressman Adam Schiff and others have similarly indicated an interest in doing this. Lee Hamilton, former member, and others participated on the 9/11 commission. We have to look at this. States should not be bidding against the federal government. One spouse shouldn't have to access equipment. I was on a call earlier today, and I asked where were we in supply versus demand in terms of getting PPE equipment here in the country, and I couldn't get an answer. Now, I got that we have stuff coming from here, we have things coming from here. I said, okay, and percentage-wise, what you quoted to us, where does that fit in terms of the number of items we need from a PPE standpoint? April, they couldn't tell us. So that's that patchwork that Secretary Johnson is talking about. We hear a lot of numbers thrown at us, but I'm still hearing from hospitals in my district who are short of equipment. So it doesn't help me.
What equipment? What equipment? Qualify and quantify if you can.
Okay, N95 mask. I'm talking about the gowns, the gloves, simple things that are not as complicated as the ventilators and some other things, but nonetheless, we're still short. The test kits, we're still short on test kits. So those communities are still at risk because this patchwork system is like putting your finger in the dam to try to plug the leak, but you find out there are more leaks than you have fingers. And so that continues to be our challenge.
So this patchwork approach, and what we have to really relate to those who are watching this, is that this is not such a cerebral conversation that you can't understand. This patchwork issue means people, if we get sick, we're not being taken care of if we need a ventilator because there is something going on that someone has to beg and borrow to get it. So this is real. This is not something made up. People are still begging for things, as people are still begging for essential things for people to be able to function and stay healthy, as people are talking about reopening the nation. Now, I'm going to ask you, Chairman Thompson, and I'm going to ask you this seriously. This patchwork, is this about ineptness, or is this about profiteering, or both?
Well, I think we have a patchwork there too. The people we have in place are those persons that the president has indicated he want there because he like people who hold acting positions. He doesn't necessarily like permanent people. And the fact that we have so many acting people within FEMA and DHS proves it, as well as other agencies. The other thing we've seen coming on the scene is we've seen contracting where people are paying 8, 9, 10 times more for product than you normally would. We have a system in FEMA under the disaster program that allows for purchasing and acquisition. Well, when you decide to let everybody buy, and that's that patchwork again that creates the problem. It's ineptness. Probably we will hear after this pandemic is over some illegal activities going on in terms of contracting. We always have it. But I think our biggest problem right now is the system is not functioning to the extent that those who are professionals indicate that it should. And it's probably not going to get where it needs to be as long as the president keeps injecting himself into the equation. Couple of examples. This issue around when did you know something was wrong? Well, I have information that the World Health Organization had already sent certain information to this administration. FEMA started looking at it long before the Stafford Act trigger was pulled for them to become activated.
What are the dates, sir? What are the dates? What are the dates? Do you have the dates?
December is
December
the date
2019. December 2019.
2019, right. And so coming forward, we can see all the things that didn't happen that come in denial, and that's part of the patchwork. If we have a problem, April, let's address it. That's not a sign of weakness. That's really a sign of strength. And so when FEMA finally got the authority, obviously the horse in terms of this pandemic was already out of the barn. And so they were playing catch up. And so consequently, the authorities necessary to exercise, they were never there because HHS was in a position to helm part of the pandemic. And so we had to kind of get them on the same page. They were still using their structure for acquisition when it should have been FEMA's authority to do the acquisition. So we've had a number of those patchwork incidents to happen. And so we're challenged. You know, we have 40,000 more people from China to come into the country after the so-called authority was taken away. But that was for those people who are from China who are not American citizens. There are a lot of American citizens who came back who just walked right through our airports and didn't get checked. So there were a number of things that people are trying to defend that if the system had worked, we could have avoided a number of things we are faced with now.
So you just made some news. You made a lot of news there. One, the president is saying this is no one's fault. But if indeed, Chairman Thompson, what you said, that you have received letters from WHO and other world organizations dated December 2019, and they gave this administration information, they had ample time to get ahead of this curve. And also, and this kind of gives me an understanding maybe why the president is demonizing the World Health Organization, WHO, and the World Food Organization. Secretary Johnson, I want to go to you with all of this. This is a lot. In the midst of death, in the midst of hurt, in the midst of an economy that's hurting, what should Homeland Security be doing right now? Forget all the patchwork approaches. Forget, people are doing the best that they can. What should they be doing right now?
FEMA's principal role, the department's principal role, and indeed the federal government's principal role in a crisis like this is resources. Early on, the president said, we're not shipping clerks. Well, in fact, that is the principal role of the federal government in a crisis like this, to ensure that the communities, the hospitals, the states, the cities have what they need when it comes to test kits, PPE, ventilators, masks, and the like. And so that is responsibility number one for the United States government through the Department of Homeland Security, through FEMA. Now, I want to come back to something here because I think it's so important. When this thing is over, by the time this thing is over, we'll probably be at over 1 million cases here in the United States. And
say that again. Say that again.
When this thing is over, by the time the crisis recedes, we will probably be at over 1 million cases here just in the United States. And the death toll from COVID-19 will probably exceed that of the entire Vietnam War, 58,000 people. And I'm quite sure that Congress, Chairman Thompson and his committee will and should ask the questions of the executive branch. What should we do better so that something like this can't happen again to the extent that it has happened? So right now, we've got to deal with the here and now. I think it is so important to stress the following, and I've said this a number of times publicly. We are beginning to flatten the curve. I live in northern New Jersey. I sit in my house in northern New Jersey, 12 miles from Manhattan, and I work in Manhattan in New York City when I'm allowed to go there. And so I sit at the epicenter of this crisis right now. And we are beginning to slow the spread of this virus. We are beginning to see light at the end of this tunnel. But let's not begin to think, therefore, that we can lighten up, that it's time to lighten up. It's like swimming across a deep channel with a strong current. You can see the coastline. It doesn't mean you stop swimming. It means you got to double down. So our nation and state by state, we've done a lot of good work at social distancing, at physical distancing, at hygiene, and we are beginning to slow the spread of this. But that doesn't mean that it's time to lighten up. It doesn't mean now is the time to go back to work. And regrettably, our president is giving mixed messages about this by saying, here are my guidelines, follow the guidelines, but then send out tweets that say, liberate Michigan, liberate Minnesota, which to any English-speaking person means invites protest, invites demonstration, and perhaps even disobedience. And now is not the time for that, because this is literally life and death. So I think it's important for people in the executive branch. This has been true of the governor of New York. He's been very good about this. And those in Congress to continue to stress to their constituents that we've got to maintain the discipline that we've shown over the last several weeks in order to get through this. Now is not the time to lighten up. We're all getting impatient in certain parts of the country. We're starting to burst at the seams a little bit, but we've got to continue to focus on public safety and social distancing until our governors and our mayors say it is time to begin a plan to go back to work.
So now society seems to be broken into two different classes. Those who are now, they're using the word privilege to be able to work from home versus those who are hourly workers who have to get back and work. But it goes back to this situation, Secretary Johnson, that you just brought up, this liberate issue. You've got people who are taking their children without masks, without gloves, to these rallies. And people are not social distancing. And I talked to the director of infectious disease modeling and analysis at Yale University yesterday. And she said, basically we could possibly see another spike in these places where these rallies are happening with this liberation movement. What say you about that? And then also going into the issue of the governor of Georgia. He wants to reopen the economy. We get the economy is suffering, but at what cost? He's saying, and this just rattles my mind. He's saying he's going to open up beauty salons and nail shops and bowling alleys. And I'm thinking, okay, a bowling alley, I'm using my hands on the ball that other people use, sticking my fingers in holes. Who's going to clean that every time someone uses it, throws it down a lane? Nails. There's a thing called SNS where you dip your finger. People use the same thing. It's safety is still an issue with this opening up the economy. And again, reinfection could come back. What say both of you to that?
Well, I know Benny's going to have some thoughts about this, but petitioning the government for the redress of grievances is fundamental to a free, open, democratic society like this one. However, we are in the midst of a lethal pandemic. We are in the midst of a public safety crisis. And so when people go out in public demonstrations, remove their mask, come within close proximity of each other, you're not just endangering yourself, you're endangering your wife, your parents, your children, your coworkers, your neighbors.
Anyone you come in contact with.
Anyone you come in contact with, even if you are asymptomatic. And so this is an extraordinary time where the only way we are going to get where we all desperately want to be is if we continue the discipline of social distancing and hygiene and wait for our state and local leaders to tell us when, assuming that they're doing so diligently and carefully, to tell us when it is okay to go back to life as normal in phases. Over.
Jay, you're exactly right. April, the other thing we have to do is we absolutely have to listen to the health professionals, the people who do this day in and day out. They know exactly what needs to be done. Just before we left Washington, we had the former head of the CDC come before the committee, and he said, in a time like a pandemic, you absolutely have to tell the people the truth. You have to let them know how good something is, how bad it is, but above all, tell the truth. For too long, this administration was in denial as to how dangerous this virus would be on the American people. And so some people will love one way, but what we now have is still the need for people in leadership to tell the truth. We don't get it at the press conferences in many instances. We get the mixed messages. And so for us, who are policymakers, we're tasked with the responsibility of trying to reinterpret what the executive branch is saying in our respective districts. And people are saying, but the president said this. Yeah, but that's not what the health professionals say. The health professionals say exactly, wash your hands for 20 seconds. Social distancing is important. All of those things that they have known historically to be true, you need to follow them. So on top of that is the resources necessary to do it. FEMA historically has been called the cavalry. That means that when you need help, here comes FEMA. But if FEMA is hamstrung by patchwork policies, then it can't nearly be as effective as it has been in the past. So we're struggling. This administration wants to come with a smiley face at every press conference, but you should tell the truth. And the fact checkers have already said that this administration has lied over 18,000 times in a little over 3 years. So the polls are now saying that the confidence factor in the executive branch is uh, uh, lower than it's been in quite some time. But I think so much of that is how they have addressed this pandemic. You have to tell the people the truth, and you let the professionals do their job. Somebody asked me this morning, said, what happened to the Surgeon General? They used to have him on all the press conferences. And about a week ago, when he made the statement about
Big Mama.
the impact on minorities, he hadn't been seen since.
People were offended by Big Mama and Papa, and I mean, you know, some of us do have nicknames, but it was almost in a mocking and patronizing way in a serious moment. So, and I get you, and I get why they may have pulled away, and that brings us to another piece. The Black community disproportionately is contracting and dying from coronavirus in places. I mean, we're getting stats from Milwaukee, Michigan, from Chicago, now from Maryland, DC. It's a problem, and there is a call for these testing kits to be placed in these communities where we're seeing these numbers to help figure out what to do and triage and try to prevent what have you. With all of this patchwork that's going on, with all this ineptness, can the Black community rely on FEMA at this point to be effective for them to stave this off or to help bring down the numbers, to flatten the curve in the Black community?
Well, because we are in this situation, FEMA has the primary responsibility to address it. The challenge is communities until very recently didn't have enough data to support what you're hearing now. With the data showing how the adverse impact on people of color this pandemic is having, FEMA now has to step up. But now what FEMA has to do is partner with the National Medical Association, National Black Nurses, Urban League, NAACP, every major African-American organization in the country to help get the word out. One of the things we learned in Katrina is help has to go where the problem is. When people started setting up right after Katrina in New Orleans and other places, they were in the suburbs. Well, the problem was in the 9th Ward and some of the other inner city areas. So we are going to have to go in these respective communities where the problems are and not ask the people to come.
And New Orleans is affected terribly right now by this.
Absolutely. For instance, in my district, a lot of the area is rural and we don't have public transportation. So we're going to have to say that we have to put a transportation component into the testing component if we're going to really get people to come and do the test. You can't say, well, we haven't done that before. Well, you have to think outside the box. And this designation gives us the ability and flexibility to think outside the box to address the problem.
So what's
April,
yes, sir.
April, can I add to that?
Johnson, yes.
All of the issues, all of the socioeconomic distinctions that exist even in normal times are exacerbated with this crisis. The underlying health issues that exist in the Black community, for example, the level of health care that the Black community enjoys or does not enjoy, all of that is exacerbated right now. You noted Milwaukee. I saw a statistic that 28% of Milwaukee is Black and 70% of the COVID deaths there are Black. And there's another point, there's another aspect of this. I saw a photograph a couple of weeks ago, which I'll never forget. It was about 3 weeks ago. It's a New York City subway. And it was crowded. And it was crowded, full of people of color that didn't have gloves, didn't have masks. and they were going to work because they had to go to work in construction or what have you, and they needed to go to work. They needed to keep working. And because the number of subway lines, the frequency of the trains has been cut back so significantly, they have to all crowd into the train that comes once every 20 minutes. And so that's, you know, you cannot, across the socioeconomic vastness of this country, we can't all work remotely like the three of us are doing right now. Some of us have to keep going to work, and A, because they're not exempt, and B, because they need to. And they go to work in circumstances where social distancing, physical distancing, and hygiene are not best practice. So that's one of the reasons why we're seeing the crisis being exacerbated in the communities of color.
So thank you, Secretary Johnson. Chairman Thompson, what can Congress do? I know you have Congresswoman Karen Bass, the head of the Congressional Black Caucus, who's working on this, along with Congresswoman Barbara Lee, Ayanna Pressley, and so many more, who are really trying to drill down on this, because this just goes back to the inequities. This is basically an ACA issue, the Affordable Care Act, all over again. What can Congress do to ensure that FEMA is doing this now instead of this patchwork issue? What can Congress do at this moment?
Well, several things. We've all gone on record publicly saying they have to do more. Every member of the Congressional Black Caucus has offered their time and effort to this. We brought in a number of constituent organizations, National Baptist Convention, a number of other religious organizations. We'll continue to make this effort. But you know, this has to be a coordinated effort, because we have to know how many people we're testing. We have to know what the results are in a timely manner. And if we have to go get those individuals, we have to have a system in place. Well, the system's there, is just not working for everyone. So the Congressional Black Caucus, as well as other members of Congress, have already made the case that more needs to be done. There's no cookie cutter approach. Every community potentially is different. We just have to get in there, not be afraid to go in those communities. And what some of us have done, we cut TSAs in our own respective communities. When the Department of Health came to me and they told me where they were going, first thing I told them, I said, Black people not going there. That's not their normal mode of travel. They said, well, where do we need to go? I said, I'll give you the places. So I helped in my district get the Department of Health to go into the areas and work with the groups and individuals who most likely can help. So we're trying, our challenge, April, is simply because we're not able to get to Washington and do what we normally do. In some instances, we have to raise hell from afar. We're doing it. We'll continue to do it. And let me say, on a personal note, I appreciate members of the media asking the questions of this administration that we can't get in front of to ask. So your oversight as members of the media in helping with this process is genuinely appreciated.
Well, I'm going to be honest with you. I'm watching from afar because I am one of those people who has underlying issues. And like many of us, and I am very fearful of leaving my home. And I cheer on Yamiche and all the rest of them, Darlene, all of them. And I'm still reporting though. But this is real. This has affected so many of us. And but I'm going to keep asking questions like I'm asking you today. But I want to go to something that's also in the news since you brought it up, Chairman Thompson. Immigration. At a time such as this, we got immigration back on the forefront. And one thing that really I remember vividly with Secretary Jay Johnson years ago, he was Secretary of Homeland Security. And we both happened to be in Boston at a commencement at the time. I think you remember Secretary Johnson. And before he was a commencement speaker, and before he spoke, and before we went onto the stage at Cambridge College, the commencement there, he stood, we were on the water, and he stood looking at the shoreline because he protects that, you know, and I that picture always has stood in my head when I think about immigration and what someone in that position does. They look for the vulnerabilities, the cracks in the system. And when we talk about the cracks in the system with immigration, it seems to be a problem when it comes to those who are detained and deported through our ICE system. There are now reports that medical screening within ICE immigration detention facilities is non-existent or inadequate. So there have been cases of immigrant detainees who may have been exposed to the virus that are then deported. Guatemala has already received dozens of deported migrants from the US who tested positive for COVID-19 upon landing. And there are also reports from Haiti as well. What do you say about this, Secretary Johnson?
Two things. One, first, I think about the president's announcement last night that he was going to shut down immigration. Well, first of all, you can't shut down immigration. You can shut down legal immigration, but as long as we have a land border of 1,900 miles with Mexico, you can't just shut down all immigration. So that's one thing. Number two, I'm quite sure that the announcement he made came without a lot of planning. If you believe the public reports, the Department of Homeland Security was caught off guard by this. And shutting down all immigration is something that takes weeks to plan. And, you know, what type of immigration are we talking about? Are we talking about lawful permanent residents who happen to be overseas? Are we talking about the spouses of US citizens? And so that's a complicated thing. You can't just make an announcement on a Monday night and expect it to happen on Tuesday morning. And one of the issues I have with this administration is their first impulse when you are confronted with a crisis is to shut down immigration. And the president keeps talking about how on January 31st, he stopped immigration from China. Well, that's not exactly true. That order had a lot of exceptions in it, and the virus got here anyway. 43,000 dead Americans says that. And so the first impulse and the last impulse can't always be just stop immigration to prevent a public health disaster that is already here within our borders. Now, to the second point, and this is the point you raised, I'm quite sure that in immigration detention, the ability to test, to distance people is inadequate. It is not, immigration detention is not an optimal circumstance for regulating and monitoring public health. I don't know what the numbers look like on the apprehensions on our southern border. Last time I heard they were low. I really worry that they will rise again. But as you point out, April, we are in fact exporting the virus when we deport people back to Central America who may actually have COVID-19. And so,
should we stop the deportations at this moment? Should we stop them?
Well, a deportation is a two-party exercise, as Chairman Thompson knows. You've got to send somebody back, and then the receiving country has to agree to accept them back. And I wouldn't be surprised if countries in Central America say, "Whoa, wait a minute. I'm happy to take back my nationals if you deport them, but I'm not happy about taking back this disease, this virus." And so I wouldn't be surprised if we start seeing a lot of resistance in Central America, if that is what is happening. And so, that's a conversation that should be going on right now with the countries in that region. We have to have a sensible approach to this. If we expect cooperation from Central America in times of a crisis in illegal immigration on our southern border, then they're entitled, I think, to some level of cooperation from us when it comes to the potential for us exporting the virus to that region of the world.
Well, April, just to put a point on that, I talked to Secretary Wolf about 60 Haitians recently returned back to Haiti. I talked about my concern about the testing protocols that had been applied to those individuals. Well, he said, well, we have some, they have to, we look at them if they don't look sick, if they don't tell us they have.
Wait a minute, they're profiled, not temperature taken, they're profiled.
Right, and I told him I was very concerned about the cursory review, especially in this time of pandemic. And I asked him to at least pause the program till we could come up with something more definitive. But unfortunately, those individuals were sent back to Haiti. And now we're getting reports that there are some individuals that we deported to Haiti that have come back, that have developed the virus. Guatemala has already said to us, no, you can't send us any more deportations because the last group you sent was infected. So as Jay's saying, it's kind of messing up our foreign policy, and you know, our system of immigration only works if we talk to our friends and neighbors also. And so this president can't, even though he wants to, wall off this country and think that solves the problem. It just creates a bigger problem. And so I think this is another one of those distractions that this president is noted for. You know, to cut the money that we give WHO in the midst of a pandemic. Now to say no immigration in the midst of a pandemic, just issue after issue that you say, well, why does this have, what does this have to do with the pandemic? Well, it's a deflection. And so this whole notion about encouraging people to get out and demonstrate, that's a problem. The health professionals say, look, you're risking folks' lives and the lives of people they come in contact with 2, 3 days later by encouraging this kind of activity. A thoughtful leader would follow the medical advice that we've already talked about, rather than try to run a political campaign in the midst of a pandemic.
That's powerful and that's real. You know, we have passed an hour. This I can talk to you guys for a long time because this is real stuff. This is stuff that we're not getting truth. We're not getting the do's and don'ts. We're not getting what's supposed to happen from a lot of other people. You guys are there, and I appreciate you. And I have one more question I'm going to ask you, and then I'm going to, if I miss something, I want you guys to give me your final thoughts and as we wrap it up. But my last question, another community that's very vulnerable, and I'm talking about the Native American community, the reservations, those people who are in spaces and places that we don't always think about in states like Texas, New Mexico, and Arizona. What are the efforts to help them as well?
Well, let me begin with this, April. In more remote areas of the country, not all Native Americans live in remote areas, obviously, but
right.
More remote areas of the country, my concern would be that the healthcare is not as robust as it would be in an urban area. And so I hope that the authority figures in those parts of the country are thinking ahead of the curve, are trying to anticipate the problem and not be lagging behind, not struggling to keep up. And in closing, I want to say this, and I think it's important to say this. Uh, I was Secretary of Homeland Security 39 months ago, and so that's not long enough for me to forget how difficult it is to respond to a crisis. So I'm not going to sit here and tell you that the prior administration would have gotten it all perfect. I'm quite sure that there'd be a lot of criticism coming down on whoever is in power when you're dealing with a once in a century crisis like this. Having said that, I think it's important to focus on the here and now and how we go forward to deal with this. And I cannot stress enough that for those who are losing patience with staying away from work, from watching our economy plummet, and who want to go back to life as normal, the way to do that is to stay the course, at least for the time being, and continue to engage in physical distancing, good hygiene. We're all watching the demonstrations around the country, and our president is not helping. It's not right to say to governors, it's on you, but then issue a tweet, liberate Minnesota, liberate Michigan, to make their life even more complicated. The president has to accept responsibility. This seems to be the antithesis of the buck stops here. And so the American public, and it's largely on them, has to continue to stay disciplined for the time being. Over.
Thank you, Secretary Johnson. Chairman Thompson?
Well, Secretary Johnson's absolutely correct. We have to follow the medical professionals. They've given us the roadmap to getting over this pandemic. We have to follow it. It's up to our leaders to recommend and encourage its citizens to do just that. The social distancing, the general hygiene requirements, all those things are so important. But we have to get, to the extent we can, FEMA to continue to maintain a robust presence in all these states and communities. We have committed ourselves from a legislative standpoint to give FEMA all the money they need to do their job. That job requires coordination, and it also requires leaving no individual out of the process. So whether you're Native American, African American, or whomever, if you are impacted negatively by this pandemic, then there are programs out here to address it. And so I encourage those individuals to help us get beyond this. We are a great nation. We will survive this, but we will get there faster if we follow the medical advice more so than some of the political advice that we're getting.
Chairman Thompson, thank you so much. It was an honor to sit in on this very important and news-making Zoom conversation. And it's always great to see former Homeland Security head Jay Johnson. I thank both of you for putting this in perspective. This time of hope, this time of hope for a better day, but this time where we're also being cautious. A time where we are socially connected but physically distant. I want to thank you guys. I am April Ryan, White House correspondent for the American Urban Radio Networks. You may not see me in the White House right now because, like you, I'm very concerned about this pandemic, and I'm also CNN political analyst. We'll see you soon. Thank you so much for joining in. This was a news-making conversation. Trust me, I'm getting ready to call Chairman Thompson and get some more information. We thank you. Stay safe, social distance, and be well. God bless.
Thank you.